Good day, guys. Today we're gonna talk about an environmental disease called Queensland fever. So, what is Queensland fever? Queensland fever, or Q fever, is a zoonotic bacterial disease caused by Coxiella burnetii. It is a worldwide disease, but it is most common in Australia. The disease is named after the Australian state of Queensland, where it was first identified in 1935. Many people who are infected with Q fever do not have any symptoms. However, people who do become sick often have a flu-like illness with symptoms such as fever, headache, muscle aches, vomiting, shortness of breath, and diarrhea. Q fever is caused by the bacterium Coxiella burnetii. Bacteria are found in the bird fluids, feces, and urine of infected animals. People can become infected by breathing in droplets or dust contaminated with these fluids. The bacteria can also survive in the environment for long periods of time, so they can also be spread through contact with contaminated soil or hay. People who are at increased risk for Q fever include farmers and other people who work with animals, people who live in rural areas, people who travel to areas where Q fever is common, and lastly, people who have weakened immune system. Prevention tips. Number 1, avoiding contact with bird fluids, feces, and urine from infected animals. Number 2, wearing a mask when working with animals. And lastly, wash hands frequently and avoid contact with contaminated soil or hay. Q fever can be treated with antibiotics. Most people make a full recovery and become immune to future Q fever infections. However, some people may develop complications such as pneumonia or hepatitis. Q fever is a serious but treatable disease. People who are at risk for infection should take steps to protect themselves from exposure to the bacteria. If you think you may have Q fever, it is important to see a doctor right away. Queensland fever, a fever so fierce it'll make you want to pierce your ears. That's it, guys. Thank you for listening and see you around.